Question 1. A public health nurse is triaging patients after a tornado. Which client should the nurse prioritize for immediate care? A. A client with a small laceration on the arm. B. A client with a fractured tibia and stable vitals. C. A client with abdominal bruising and signs of internal bleeding. D. A client crying for missing family members. Answer. C. A client with abdominal bruising and signs of internal bleeding. Question 2. A nurse is delegating tasks during a mass vaccination clinic. Which task is most appropriate to assign to an LPN? A. Conducting community health teaching. B. Administering intramuscular vaccines. C. Initial assessment of vaccine recipients. D. Monitoring for severe allergic reactions post-vaccine. Answer. B. Administering intramuscular vaccines. Question 3. In a home visit, which finding would require immediate follow-up by the public health nurse? A. Expired canned food in the pantry. B. Child with signs of physical bruising in different stages of healing. C. Missing smoke detectors. D. Presence of a dog without rabies vaccination. Answer. B. Child with signs of physical bruising in different stages of healing. Question 4. Which activity is within the scope of practice for a community health nurse assistant? A. Developing care plans. B. Administering insulin injections. C. Documenting client complaints. D. Performing wound care independently. Answer. C. Documenting client complaints. Question 5. During a home health visit, a nurse notes a client with COPD is using a charcoal grill indoors. What is the best initial action? A. Call the fire department. B. Notify the healthcare provider. C. Educate the client about carbon monoxide risks. D. Document and schedule a revisit. Answer. C. Educate the client about carbon monoxide risks. Question 6. A nurse is developing a disaster plan for a school. What is the priority component? A. Identifying local news contacts. B. Establishing student reunification protocols. C. Scheduling yearly fire drills. D. Creating a food supply inventory. Answer. B. Establishing student reunification protocols. Question 7. When prioritizing care for a community outbreak, which patient should be assessed first? A. A febrile adult with sore throat. B. An elderly client with productive cough and confusion. C. A child with a mild rash. D. A healthy adult requesting testing. Answer. B. An elderly client with productive cough and confusion. Question 8. Which task is most appropriate to delegate to an unlicensed assistive personnel, UAP, in a community clinic? A. Assisting a client with insulin administration. B. Teaching a client how to use an inhaler. C. Measuring and documenting vital signs. D. Conducting a dietary assessment. Answer. C. Measuring and documenting vital signs. Question 9. A community health nurse identifies an increase in asthma in children near an industrial area. What is the best intervention? A. Refer all children to pulmonologists. B. Initiate an environmental health assessment. C. Distribute brochures on asthma control. D. Recommend relocation of families. Answer. B. Initiate an environmental health assessment. Question 10. Which public health activity demonstrates primary prevention? A. Screening for tuberculosis. B. Administering antibiotics for gonorrhea. C. Immunizing children against measles. D. Providing rehabilitation after stroke. Answer. C. Immunizing children against measles. Question 11. In disaster triage, which client should receive a red tag? A. Client with massive head trauma. B. Client with a closed fracture. C. Client with severe burns and compromised airway. D. Client with minor abrasions. Answer. C. Client with severe burns and compromised airway. Question 12. A community nurse is assessing social determinants of health. Which is an example of a structural determinant? A. Nutritional habits. B. Employment opportunities. C. Smoking behavior. D. Family support. Answer. B. Employment opportunities. Question 13. During a home visit, the nurse suspects elder abuse. What is the priority action? A. Ask the caregiver for an explanation. B. Notify Adult Protective Services. C. Continue the visit and document concerns. D. Encourage the elder to move out. Answer. B. Notify Adult Protective Services. Question 14. Which best reflects the role of a public health nurse in preventing communicable diseases? A. Prescribing antibiotics for infections. B. Administering vaccines during outbreaks. C. Treating patients in emergency rooms. D. Conducting surgical procedures in rural areas. Answer. B. Administering vaccines during outbreaks. Question 15. A nurse receives reports of increased absenteeism in a school. What is the best initial action? A. Refer all students to pediatricians. B. Interview teachers for possible causes. C. Notify local health authorities. D. Review absentee data and conduct surveillance. Answer. D. Review absentee data and conduct surveillance. Question 16. Which action demonstrates tertiary prevention in community health? A. Teaching teens about STDs. B. Providing vaccines to children. C. Organizing a smoking cessation class. D. Offering physical therapy to post-stroke patients. Answer. D. Offering physical therapy to post-stroke patients. Question 17. Which of the following best describes case management by a community health nurse? A. Distributing health brochures to families. B. Supervising hand washing at daycare centers. C. Coordinating services for a child with special needs. D. Attending a city council meeting. Answer. C. Coordinating services for a child with special needs. Question 18. A nurse is caring for a group of clients. Which one requires immediate public health intervention? A. Homeless client with untreated diabetes. B. Teenager with acne seeking birth control. C. Middle-aged client with high cholesterol. D. Immigrant with no health insurance. Answer. A. Homeless client with untreated diabetes. Question 19. Which of the following is the best method to evaluate the effectiveness of a community education program on smoking cessation? A. Number of pamphlets distributed. B. Decrease in tobacco sales in the area. C. Participant satisfaction survey results. D. Reduction in self-reported smoking rates. Answer. D. Reduction in self-reported smoking rates. Question 20. Which role does a public health nurse fulfill when lobbying for improved air quality laws? A. Case manager. B. Advocate. C. Educator. D. Care provider. Answer. B. Advocate. Question 21. During a measles outbreak, which action by the public health nurse is most appropriate? A. Isolate exposed clients for 7 days. B. Begin mass vaccination of susceptible populations. C. Report the outbreak to local media. D. Close all schools in the region. Answer. B. Begin mass vaccination of susceptible populations. Question 22. Which task is most appropriate for a nurse to delegate to a community health worker? A. Administering hepatitis B vaccines. B. Educating about lifestyle changes for diabetes. C. Performing wound dressing changes. D. Conducting in-depth psychosocial assessments. Answer: B. Educating about lifestyle changes for diabetes. Question 23. Which patient should the nurse assess first during a community clinic triage? A 45-year-old with a persistent dry cough. B. A 68-year-old with shortness of breath and chest tightness. C. A 21-year-old with abdominal bloating. D. A 35-year-old requesting a routine checkup. Answer: B. A 68-year-old with shortness of breath and chest tightness. Question 24. What is the priority focus for a nurse developing a health promotion plan for a low-income urban population? A. Providing handouts on disease prevention. B. Assessing barriers to accessing healthcare. C. Training residents in CPR techniques. D. Encouraging use of herbal remedies. Answer: B. Assessing barriers to accessing healthcare. Question 25. What is the most appropriate response when a client refuses a flu vaccine at a mobile clinic? A. Document the refusal and notify the physician. B. Instruct the client to return later. C. Respect the decision and provide education on risks. D. Report the refusal to local authorities. Answer: C. Respect the decision and provide education on risks. Question 26. Which intervention reflects secondary prevention in public health? A. Creating educational materials on smoking risks. B. Screening high school students for scoliosis. C. Organizing rehabilitation for stroke survivors. D. Immunizing children against polio. Answer: B. Screening high school students for scoliosis. Question 27. A nurse is preparing a teaching session on lice prevention in a school. What is the best teaching strategy? A. Send written instructions home with students. B. Provide a lecture to school staff only. C. Use interactive games and visuals with students. D. Distribute medicated shampoos to families. Answer: C. Use interactive games and visuals with students. Question 28. Which statement best reflects the philosophy of community-based nursing? A. Care is focused solely on the individual patient. B. Emphasis is placed on illness treatment in hospitals. C. Health is considered within the context of the population. D. Preventive care is not emphasized. Answer: C. Health is considered within the context of the population. Question 29. What is the best indicator of effective delegation to a UAP in the community setting? A. The UAP reports satisfaction with the task. B. The nurse receives no complaints from the client. C. The task is completed safely and as instructed. D. The client thanks the nurse for the help. Answer: C. The task is completed safely and as instructed. Question 30. A client in a rural area has no transportation to follow-up appointments. What is the nurse's priority action? A. Recommend telehealth services. B. Report noncompliance to the provider. C. Instruct the client to arrange transportation. D. Discontinue follow-up care. Answer: A. Recommend telehealth services. Question 31. A nurse is monitoring the effectiveness of a lead poisoning prevention program. What is the best evaluation method? A. Number of flyers distributed. B. Participant satisfaction surveys. C. Decreased lead levels in tested children. D. Increased attendance at community meetings. Answer: C. Decreased lead levels in tested children. Question 32. A nurse is conducting a windshield survey. What should be the nurse's primary goal? A. Promote the image of a health department. B. Interview every resident in the community. C. Assess visible environmental and social conditions. D. Deliver direct patient care. Answer: C. Assess visible environmental and social conditions. Question 33. Which best describes the nurse's role in policy development for underserved populations? A. Avoid political advocacy due to bias. B. Refer concerns to lawmakers without engagement. C. Actively participate in advocacy and policy change. D. Maintain neutrality in all public health matters. Answer. C. Actively participate in advocacy and policy change. Question 34. What is the most appropriate community intervention for an increase in domestic violence cases? A. Launch a hotline for abuse victims. B. Recommend family separation. C. Increase police patrols. D. Remove children from affected homes. Answer. A. Launch a hotline for abuse victims. Question 35. During a pandemic, which nurse action is most aligned with tertiary prevention? A. Teaching hand-washing techniques. B. Isolating exposed individuals. C. Providing ventilator support to critical patients. D. Educating the public on vaccine benefits. Answer. C. Providing ventilator support to critical patients. Question 36. Which describes cultural competence in community health nursing? A. Providing the same care to all clients. B. Avoiding cultural topics during care. C. Adapting care based on the client's cultural beliefs. D. Referring clients to spiritual leaders only. Answer. C. Adapting care based on the client's cultural beliefs. Question 37. A nurse is preparing a community presentation on safe food handling. What is the most important focus? A. Local food preferences. B. Seasonal recipes. C. Preventing cross-contamination. D. Promoting organic foods. Answer. C. Preventing cross-contamination. Question 38. A nurse is managing care for a client with untreated tuberculosis in a shelter. What is the nurse's immediate action? A. Move the client to a private area and initiate isolation protocol. B. Allow the client to stay and monitor symptoms. C. Discharge the client and refer to a specialist. D. Instruct others in the shelter to avoid the client. Answer. A. Move the client to a private area and initiate isolation protocol. Question 39. Which role does the nurse fulfill by arranging dental care for children in underserved schools? A. Educator. B. Clinician. C. Case manager. D. Researcher. Answer. C. Case manager. Question 40. What is the most important goal of a school-based health screening program? A. Increase test scores. B. Promote physical activity. C. Identify health problems early. D. Prevent classroom disruptions. Answer. C. Identify health problems early. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.